An acute myocardial infarct occurs when there is reduced blood flow to the heart, resulting in damage to the heart tissue and ultimately impairing its function. This acute event is almost always a result of pre-existing coronary artery disease in an individual. Ischemic heart disease is the leading cause of years lost due to early mortality and the second leading cause of disability-adjusted life years lost in Canada. There is a drastic increase in the prevalence of ischemic heart disease in Canadians after the age of 50 years, and the rates continue to rise with changes to our environment. There are well-documented preventable risk factors to lower the chances of developing coronary artery disease and a subsequent acute myocardial infarction. Many of these risk factors are interrelated and are equally important for overall good health and prevention of many other chronic diseases. Some of the main risk factors include high blood pressure, smoking cigarettes, heavy alcohol intake, overweight/obesity, and diabetes. The aging Elgin St. Thomas region is vulnerable to many chronic health conditions, specifically ischemic heart disease. Based on consensus data, the densest age cohort in the population includes those aged 50 to 64 years old. According to Stats Canada Health Profile, 366 individuals per 100,000 in the Elgin St. Thomas area were hospitalized due to an acute myocardial infarction event. Our program has been designed to target members of the Elgin St. Thomas population as they exhibit a higher rate of risk factors associated with myocardial infarction when compared to other populations. The most significant percentage difference between Elgin St. Thomas and other populations, such as Toronto, are in assessing risk factors for myocardial infarction related to obesity. The rate of obesity in Elgin St. Thomas is 168% greater than the rates in Toronto. Elgin St. Thomas also exhibits higher rates of blood pressure, smoking, alcohol consumption, obesity, and diabetes. These risk factors collectively contribute to higher rates of myocardial infarction in adults aged 50 to 64 in the Elgin St. Thomas population and are therefore the target of our public health program.
The program we have developed includes 3 educational sessions and 2 exercise sessions twice a week for 6 weeks. Educational sessions will cover topics such as coronary heart disease information, exercise, and nutrition. The program also includes education on emergency management. It is possible to limit the extent of damage caused by an acute myocardial infarction with early intervention. In the case of an emergency, the time to treatment can have a significant effect on outcome, and a few minutes can make a difference. Time to treatment can be reduced by educating individuals on the signs and symptoms to detect an emergency, ultimately resulting in improved outcomes. In addition to education, the program will include group-based exercise classes twice a week. These classes will help to get participants active and interact with other people, improving motivation and adherence. Class leaders will provide participants with information on the types of exercises to perform, as well as feedback on proper form and technique. Individual exercise will be encouraged and can be recorded daily in the exercise diary provided. The exercise diary ensures that participants are held accountable and enables you to track and monitor your individual progress.
Hi, I'm Bob, and I've struggled with obesity for most of my life, but I never knew what to do about it. My chiropractor told me that I'm in a high-risk population for developing cardiovascular disease or suffering from a heart attack. Being only 58 years old, this worried me, as I still have children at home that depend on me. Being informed that this is so preventable was eye-opening for me, and I knew I had to do something about it. I heard about this program from my friend Jim, and I thought I'd give it a try. Since taking the course, I've learned so much about cardiovascular disease, from general knowledge to risk factors, and how to change my lifestyle to prevent those risk factors. I also feel so much more comfortable in recognizing the size of a heart attack in an emergency situation, which is great for my own sake and for my family's. Not only can I recognize these signs, but I also know how to act in an emergency situation, which could save my life or someone else's. I've also been much more physically active since taking the program. Before I was so inactive, and knowing that even small amounts of physical activity now can make the biggest difference. It is also much easier learning and making changes in your lifestyle when you're working in a group setting with other like-minded people who are there for the same reasons. Overall, this program has really changed my life and my family's life. And if you or anyone you know are at a similar age or have or at risk of developing any of the risk factors for cardiovascular disease, I would highly recommend talking to your local St. Thomas chiropractor about getting involved in the program. It can save your life.
Based on previous studies investigating the success of the program, participants have shown an average 29% increase in their physical activity compared to levels before starting the program. Additionally, disease-related quality of life was reported to increase twice as much based on a self-assessment questionnaire. In terms of education, participants were able to improve general knowledge about coronary heart disease and reported greater self-confidence to act correctly in an emergency situation involving chest pain. For more information on the program, please visit our website to sign up. We hope to see you soon.